The same concept that heart surgeons use to open blocked arteries is being used to treat patients with blocked sinuses. It doesn't involve any cuts or stitches, just a guide wire and a small balloon.
Any of this tender in here?
Charlotte Watson was never someone who suffered from allergies and sinus problems.
I felt sorry for people who had them, but I didn't know the extent of what it was.
But then Charlotte started coughing, first for a day, then a week, then months, a year and a half with no relief, even taking prescription medications.
Once I started coughing, I couldn't stop. And it didn't matter what I was doing. I mean, I could be eating, talking on the phone, shopping.
When Charlotte was referred to ear, nose, and throat doctor Brad Labert, he recognized the symptoms of chronic sinusitis.
A lot of times what starts out as a general allergy problem, kind of the itchy, runny nose, that becomes congested, then leads to a problem with chronic sinus infections.
This CT scan confirmed the problem. In Charlotte's sinus cavities, these regions should be black, showing air, but instead they're almost totally blocked.
These are completely full of pus and thickening.
Dr. Labert decided balloon sinuplasty would be the best possible fix for Charlotte's sinuses.
We use a very tiny balloon, similar to the type that they use in heart procedures, to dilate the natural opening of the sinus to promote a healthier drainage of the sinus.
A soft, flexible guide wire is inserted into the blocked sinus, and the balloon is then inflated, expanding the opening by 6 times its normal size.
So we're able to do that 2 or 3 times across each opening of the sinus, withdraw the entire instrument, and remove it from the patient's nose.
Next, the sinus cavity is rinsed out to prevent a returning infection. And that's it.
The very night that this procedure was over, there was no more waiting and seeing because I have been wonderful. It totally changed my life from day one.
Charlotte is now sleeping through the night after months of staying up coughing. She says the procedure isn't pain-free, but the discomfort is well worth the result.
It hurt a little bit, but the time that it did hurt was so short of a span that I would do this again tomorrow if I had to.
Patients are awake during the procedure under general anesthesia. The in-office recovery time is about 4 hours. And asked Charlotte if she felt sore afterwards. She said she really didn't, and she was so surprised that first night she was able to actually sleep in the bed again with her husband versus
not be coughing all night,
being in the recliner and not getting any sleep.
Miserable. Well,